The aim of this short video is to give you some guidance for the first 6 weeks after the surgery to repair tendons in your hand. When you were in hospital, it's likely that you saw an occupational therapist and a physiotherapist to fit you with a lightweight splint, instruct you in some exercises, and to give you some advice on what you should and should not do whilst your tendons are healing. You should also have been given this leaflet. We know that people who follow this advice get a better result from their operation, but we also understand that there's a lot of information to take on board so soon after your injury. I hope that watching this will remind you of the advice that we gave you and help you to remember what you need to do and what you must not do. So, to begin with, your injury. You've injured one or more tendons that work your hand. The muscles here in your forearm are used to close the fingers into a fist and are responsible for the strength of your grip. Lower down the forearm, they form strings or tendons, which pass down your hand and attach onto the bones in your fingers, and each finger has 2 of these. Together, they're responsible for taking the force of your grip. They have to be strong. Just think how much weight you can hold on your fingertips. Before you start using your hand again, we want to be sure that the tendons have begun knitting together with enough strength. Your tendons have been repaired with sutures or stitches, and for the first 6 weeks, this is all that's really holding them together. For this reason, we told you to wear this splint for 6 weeks to prevent the fingers from stretching out straight. Wear it day and night. There should be no reason to take it off. We also told you not to use your hand to pick anything up for 6 weeks, and this includes the unoperated fingers. We recognise that this will be frustrating at times, but if you do use your hand in the first 6 weeks, there is a risk that the repaired tendons might break. Exercises. So, if the tendons are so fragile, why do we show you exercises? The exercises we showed you for your hand are designed to help keep the repaired tendons gliding gently inside your hand, rather like the way we would use oil to keep metal parts sliding in machinery. The movements help prevent the tendons from sticking to each other and the surrounding area in scar tissue. And this is crucial to enable us to perform smooth and intricate movements. Tendons that do not work properly in your hands can affect your ability to use your hand significantly. There are 2 exercises to carry out, and whilst they may not seem straightforward to start with, it's important you do them correctly. You'll soon find you get the hang of them. Exercise number 1. Use the unoperated hand, use your good hand, to gently push each finger on the operated hand down to your palm. Your operated fingers will be sore for a few days, and it may not reach the palm for the first week. Then take your hand away and straighten all the fingers to the back of the splint. Try your best to get the operated fingers as straight as possible, but do not force it back with the other hand. Do this exercise 5 times. Exercise number 2. Place your arm in a comfortable position with your hand positioned higher than your elbow. In the first part of the exercise, bend or tip your wrist forwards at the same time as straightening your fingers up to the top of the splint, like this. Then in the second part, bring the wrist up and back, and at the same time, close the fingers and fingertips gently towards the palm. Be careful not to squeeze the fingers onto the palm. Keep it gentle. Do this 10 times. So, do these exercises every hour during the day. Rest them in between. Don't be tempted to do extra. Keep your hand up at least at the level of your heart until the wound is healed. Don't forget to keep normal movement in your elbow and your shoulder. You will have a hand therapy appointment at 6 weeks after your operation, when the splint will come off and you'll be shown new exercises and you'll begin to use your hand again. I hope you found this advice helpful. If you have any questions or would like further advice, our phone number can be found on the back of your leaflet, or you can ask your physiotherapist on your next appointment.